And welcome to our town hall so that we can discuss the plans we've made for our students, our faculty, and our staff to reopen in the fall. I'm Sister Maureen McGarity, President, and I'm glad to have you all here with us tonight. Also with me are our Vice Presidents, our Associate Vice President for Human Resources, and all of you. I think we've tried to develop a program that will be informative and that will answer questions that you provided for us ahead of time. And if we can, we'll address how you can contact us at the end. I guess one of the things that's uppermost in everybody's mind, though, is why we would even try to reopen campus. And I have to admit, we ask ourselves that almost every day. And the answer changes, how much we can reopen campus almost every day. Because you've seen that over the past few weeks, the profile has changed completely. We thought we were going down, and now we're surging again in various parts of the country. And so, but we still believe it's worth our time and effort to try and reopen in some fashion, because we all recognize that one of the strengths of Holy Family is the connectedness of our faculty and staff with our students. And so, whenever I have spoken to students and our graduates about, what they valued most about their Holy Family experience, it's always been framed in terms of a person or persons that they interacted with here. Faculty, staff, their peers. And so there is value to that. And as we're seeing more and more, as other schools struggle with the same type of question, we believe that face-to-face instruction is very, very important for some students and their learning style. So despite everything, we still plan to try and reopen in the fall and try to do it as safely as possible. And so throughout this town hall, you'll hear various of the vice presidents trying to address different aspects of the reopening plan. And in discussing it again, we've tried to incorporate many of the questions that you sent in ahead of time. So without further ado, then, I'm going to turn the floor over to our Nelson, who's our Vice President for Finance and Administration.
Thank you, Sister Marie. I first wanted to talk with you a little bit about how what planning considerations and inputs we had in our putting together our plan for reopening. First of all, we tried to maximize input from key stakeholders, such as from the faculty, staff, students, and their families. We established then a reasonable time frame for the development, the communication, and implementation of the plan. We'll be covering some of that today. And we certainly had input from several different agencies and authorities, and that included the Centers for Disease Control of the country, the Pennsylvania Department of Education and Department of Health, and the Philadelphia Department of Education and the Department of Public Health. And they all had input into our plan. In fact, in some cases, they actually approved it. So there were not just a plan that just was looked upon internalized.
Hi, this is Jim Garvey, Vice President for University Advancement. Good evening, everyone, and thank you for joining us. I wanted to talk a little bit about probably one of the most important tools that we had to gain input from students, from parents, from faculty and staff, and that's the surveys we conducted back in the beginning of June. And I want to share some of the results with you. First of all, in terms of those participating, 71 of our full-time faculty participated, 128 part-time faculty, 132 staff, over 1,000 students, and 213 parents and guardians all shared their thoughts with us. So let's talk about the employees first, and I'm listing in front of you right now the top 5 employee concerns. First, health regulations not being followed, availability of disinfecting materials, the challenges around social distancing, in-person interactions, and returning to campus too early. But our faculty staff actually had some things they were looking forward to, and the top 3 were seeing students and colleagues and friends again, easier collaboration with others, and better work-life balance. Now, most employees, faculty and staff, reported feeling prepared to return to work, that they had the resources they needed, and they understood the change in expectations going forward. So the top 5 concerns of our parents and students were actually remarkably similar to faculty and staff. Number one, health regulations not being followed, campus not being properly disinfected, availability of disinfecting materials, campus not permitting social distancing, and going back too early. But there were some positive things that students and parents were looking forward to: courses being held in person, easier access to faculty and staff, and a better work-life balance. Now, the majority of our students and parents reported feeling prepared to return to school and that they had the resources they needed. The last part of the survey deals with residence life, and I'll turn it over to Abby. Abby.
Thanks, Jim. Good evening, everyone. This is Abby Wernicke. I am Vice President for Student Affairs. And one of the things we noted when we surveyed just the students who were planning to live in campus housing, as well as their parents and guardians, is that one of their primary concerns, should we not open the residence halls, is that some of our students live too far from campus in order to, and would be concerned about access to campus if we would not have the residence halls open. The likelihood that students would decide to live on campus, we found out will be most impacted by the following factors: whether or not we require students to wear face masks or shields, whether or not we're able to open the common areas and make those available, certain program limitations depending on restrictions due to social distancing, and students being given different roommates other than the ones they've requested, as well as being assigned housing in a different building than the one they prefer.
And so this is Eric Nelson again, the Vice President for Finance and Administration. So in coming up with our plan, we formed a committee that had cross-divisional representation that tried to maximize input from across the university. People included on that included the deans, academic, and the dean of students, student health services, student life, residence life, athletics, library services, the registrar, financial aid, and student account offices, public safety, facilities, human resources, and senior administration. We broke the committee up into several subcategories that address particular areas about opening up the campus. That included classrooms and offices, laboratories, that being both, I'll say, wet labs and simulation labs, field experiences, academic support initiatives and residence life, dining services, the campus store, athletics clubs, activities and murals, campus visitors, and transportation and overall campus considerations.
Hi everyone, I'm Mike Markowitz, Vice President for Academic Affairs, and I'd just like to share with you the factors and information that went into our planning for the instructional portions of what we're going to do returning to fall in campus. Go back, no, sorry. Okay. And you notice on the slide there that our instructional planning for fall actually began last spring. We really began to reach out to all sectors of the university community, as we've discussed: faculty, staff, students, parents, guardians, and family members, asking them to tell us what their concerns were, what type of instruction they would like to see, and how the university could best meet those needs. Thanks, Eric. From those discussions and from what we learned, we really developed a three-part plan for instruction that will go into effect in fall of 2020. The three parts of that plan are face-to-face instruction, online synchronous instruction, and online asynchronous and blended instruction. And I'm going to talk about each of these next in turn. Face-to-face instruction. For those courses that were scheduled as face-to-face, the university has gone the extra mile to make sure that our instructional spaces do not exceed 25% of the maximum seating capacity, which is what is required by state and local regulations. Any student who comes to class physically and is in a face-to-face class, as well as faculty, will be required to follow university directives for wearing of face masks, appropriate social distancing, and other elements of PPE as required and necessary. For classes that exceed, face-to-face classes that exceed 25% of seating capacity, we've concluded that they will be taught in what we're calling a split class modality. 50% of the students will attend in person, 50% of the students will attend synchronously online, and the groups will alternate every other week. The second format that we've approved and will be pursuing in the fall, we're calling online synchronous instruction. This will involve class sessions being held live at the prescribed class times and offered through our learning management system, Canvas, or its tool called Big Blue Button or WebEx. Students will be expected to attend and participate. The professor or the instructor will be live and they will attend and participate in each class session. This modality will be useful not only for those classes that have to be held in that fashion, but it will also be useful for individual students or faculty who are unable to attend classes in person because of health concerns or some other form of accommodation. The final modality that we are going to be following, and this is one that has actually been in place, and we're calling this online, asynchronous, or blended. These are courses that were originally scheduled in one of these forms. They will be instructed as planned. Now note here, we write that all such classes are designed and executed according to Quality Matters standards. This is a nationally recognized framework that guarantees the quality and the integrity of an instruction curriculum fully online. One thing we should note, if the enrollment in a blended class exceeds the maximum approved seating of an instructional space, then those planned in-person sessions will be formatted in the online synchronous format. We are required by the city, we are required by the state to ensure that our instructional spaces provide enough distance and an appropriate amount of safety for all of our students. So through these three methods, we believe that we can achieve that safely for everyone involved. For our clinical and field experiences, those rotations, whether they be for nursing students, student teachers, or other forms of required field experience, will be defined and executed in relation to and in accordance with the standards and guidelines imposed by our external accreditors and our relevant placement sites. Note here, all didactic or instructional portions of these courses will be offered in the online synchronous format. Most of our students that this applies to are nursing students. We'll be talking a little bit later about some of the questions that were raised for the safety of our students in applied healthcare systems. But we will recognize that all of the appropriate guidelines and standards must be observed to keep our students safe and allow them to achieve their clinical hours in an appropriate but in a healthy and safe environment. Classroom technology. To make this happen, the university did an extensive review of our instructional spaces. We also talked with vendors from the area and our peer institutions to learn from them what were the best approaches to integrating sophisticated technology in our classroom. We identified two formats that the university is now installing. The first, we're calling our Cisco WebEx system. This is a comprehensive interactive broadcasting system that will be installed in 8 larger classrooms across the campus. This allows the instructor to be live with his or her students, and it more easily and effectively facilitates those classes that have to be split, where half the folks are present and half the folks are at home viewing remotely. For a significant number of our smaller classrooms, we installed what we're calling our ViewSonic array. This involves an interactive display board, a camera, and an enhanced microphone that will be installed in these classrooms. So faculty will be able to teach in person and have students who are not present see them, interact with them, and participate in the class in the fullest fashion possible. We will complete the installation of this technology by the end of this month, and we're going to begin training of our faculty in August. This training has begun, I'm going to talk about this in a moment. This training actually began in the summer and has progressed nicely and we think effectively to get everyone prepared. To facilitate this change, the university has also enhanced its Wi-Fi network. We've augmented it with additional wireless access antennas, and all classroom technology is being connected directly to the wired network to ensure that everyone's connection can be live and strong and effective for the maximum amount of learning. I'd like to talk just a moment about faculty and student training. On this slide, you see that we have developed through the University Center for Teaching and Learning, we've developed different tiers of learning for our faculty. Tier 1, the basics of online learning, is for those faculty who are new to this modality. Tier 2, advanced online techniques, which is underway now, really allows our faculty to take their teaching to the next level, using online, remote, and asynchronous technology as well. Tier 3 of our training will begin in August, and this is the hands-on training. I like to say our faculty will be able to come in and play with their toys. They'll actually be able to use the technology, become familiar with it, and have it work for them in their systems. For students, and this is an important consideration for all of you who are listening, our Center for Teaching and Learning is available, is ready to help you maximize your learning experience. In addition to our Center for Academic Enhancement, tutors, trainers will be available to answer any question you have and facilitate that your learning experience is exactly what you want it to be. Before we move on, I want to make sure that everyone understands that we are here to work with you, to help this be the most positive and effective experience it can be. So any of you who have a problem, who have a question, or if you hit a wall and just don't know what to do, reach out to your faculty member, your dean, or the Center for Teaching and Learning, and help will be on the way. We stand ready to provide all that we need, all that you need, to make this the best experience possible. One last thing, early in our planning process, we considered the question of whether or not the university should amend its standard calendar. Should we stay with our fall 2020 semester calendar, abbreviate it, elongate it? After due diligence and considering all of our options, the university decided to stay with our existing fall 2020 calendar. Our reason for making this decision was threefold. First, the comprehensive instructional plan that I just described for you. Secondly, our adoption of new classroom technology. And finally, and I think most importantly, the university's unwavering commitment to strict adherence to social distancing and PPE requirements for all university spaces, classrooms, offices, etc. We are confident that we are creating safe spaces for students, and we're going to go with the calendar that we originally planned so that we can execute the full semester as organized. One important note, Holy Family is ready to convert to a fully online instructional format at any time this fall if we are mandated to do so by the state or by the city of Philadelphia. We had to do it in March, we had to do it abruptly, and I think all told, we did pretty well. We are much more prepared now for the fall. So if this happens again, we're ready for it, and our hope is that we'll be able to provide a seamless transition in the event that that's required of us to do.
All right, thanks, Mike. This is Abby again, and I'd like to talk a little bit about student accommodations. I want to emphasize this first point here that we are really interested in providing students with the most possible flexibility in relation to their instructional experience this fall. So for those students who do not want to return to campus or don't want to report to campus for face-to-face instruction, they may choose to enroll in online synchronous instruction only for the fall semester. We have had a lot of questions about that from students, honestly, since the very beginning of the summer through now. But I want to make it very clear that where we are right now is that we are able to offer that flexibility to students. So it's very important for students to communicate that to their advisors if that's something that they're interested in. Now, students who need additional accommodation based on the changes in maybe a particular instructional modality can, as always, work directly with the Office of Disability Services to establish an accommodation plan. An example of this for some of our students who rely on lip reading in order to understand their instructors, faculty will be provided with clear masks in order to allow for that lip reading to be possible.
So now I'd like to talk to you a little bit about safety measures. So as we mentioned before, and as Dr. Markowitz had said, classroom capacities have been reduced to a maximum of 25%. Attendance at campus events has been reduced or replaced with virtual options only. So you'll notice that when there's announcements about things that there's going to be options for either virtual meetings or things will be reduced in size. You'll notice also returning to campus that personal protection equipment has been installed throughout the campus and is being distributed upon reopening to all the different offices and your faculty from around the campus. Plexiglass sneeze guards are up, masks are required, hand sanitizer stations have been quadrupled. All classrooms now have a hand sanitizer station, and sanitizing wipes are being provided throughout the campus so people can clean the areas in which they feel is necessary for them to be safe in. You'll also notice increased cleaning protocols throughout the campus. So high-touch surface areas such as buttons, doorknobs, handrails, all being cleaned several times a day. And classrooms will be fumigated on a daily basis and disinfected. And so to make everybody as safe as possible. Also, HVAC systems in buildings. We've increased the amount of fresh air coming into buildings to provide the utmost of healthy environment. We've increased that amount to 25%, so all buildings will have a lot more fresh air in them than they used to. Also, you'll notice throughout campus that signage is up. Signage that communicates what the symptoms are COVID-19 and how to mitigate its spread. We have limited the entry and exit points to buildings. Some buildings have only one way in and one way out, or one way in and multiple ways out. Other areas have split entry and exit points where people have to stay to the right and hug the walls. Signages in hallways indicate that people need to stay to the right and file in a single file and maintain a 6-foot distance between the person in front of you. You'll also see that in some of our stairwells that don't allow for a 6-foot distance are either going to be one way up or one way down, or if they are wide enough for a 6-foot distance, that you would need to stay to the right as you do in hallways, maintain a 6-foot distance and stay to the right and be safe to keep everybody safe. Also, in riding elevators, every elevator now will have a capacity limit on each one of the entries into those elevators. It'll also indicate that you must wear your mask and that you must face the wall while you're inside the elevator cab. You're not allowed to face other riders if they allow for multiple people. Also, there will be a daily screening for symptoms and exposures that everybody must complete before returning to campus. That's not only students, that's also employees, including faculty and staff, and also visitors to campus. You must screen yourself before coming to campus. Social distancing is going to be mandatory to every greatest extent possible, and masks must be worn at all times while on campus, and that includes any public area or areas such as classrooms. Everybody is required to bring a mask with them, or if you forget a mask or don't have a mask for some reason, or your mask fails, we will have a supply of masks available that we will give you, but you should bring a mask to campus and wear it at all times. The only exception to mask use is when employees enter their private spaces, such as their offices. They are allowed to take their mask off, but their door must be closed. And you'll see signs on doors that say that you have to knock on a door and that you have to have your mask on in order for the person to answer it, and the person will have their mask on too in order to answer it. And the only other exception that are resident students are allowed to remove their mask when they enter their bedroom at the residence halls. There will be signage everywhere about frequent hand washing, and there will be capacities that are listed on the bathroom doors that limit the number of people that enter them. And there's also a lot more sanitizing stations that have been installed. You'll see there's a foot-operated sanitizing station, hand sanitizing station, upon the entry of every building. And then, as I said before, throughout the building, you're going to see hand sanitizing stations, including in every classroom. And also meetings among colleagues and students are highly recommended to be virtual to every greatest extent possible. That would be using technologies such as this, such as Zoom. And now I turn it over to Jen Lowling to talk a little bit about case management.
Thank you, Eric. We developed the case management protocol in conjunction with the Director of Health Services and the relevant authorities that were referenced in the very beginning of the presentation. Part of the case management will include anyone who's been exposed or suspected to have COVID-19 must self-isolate and self-monitor for 14 days before returning to campus. Anyone who tests positive for the virus may not return to campus for a minimum of 14 days from diagnosis and until appropriate testing is completed and reported. Additionally, they must have respiratory symptoms improvement and be at least 3 days after resolution of fever. If a confirmed positive case is reported, the entire campus will close for 3 business days in order to conduct contact tracing and properly sanitize. The Philadelphia Department of Health will assist the university with contact tracing, and classes will continue online while the campus is closed. Students who appear to have symptoms upon arrival on campus or who become sick during the day should be immediately dismissed and will be immediately dismissed from class and separated from other campus community members and visitors and sent home. The ill individual will be instructed to contact health services and their primary care physician for management of their healthcare needs. For employees who have symptoms, it would be the same protocol. They would be separated from all university employees, students, and visitors, sent home, and then they would be told to contact their primary care physician or other healthcare provider. In terms of testing and treatment, Holy Family has identified a network of testing centers in which a student will be referred if necessary. The testing center is conveniently located near Holy Family, and any questions about how to find a COVID-19 testing center should be directed to the University Health Services. Notification requirements include all students, faculty, and staff are required to notify the university if they are self-isolating or self-quarantining. Students are required to notify their academic deans, and in turn, the deans will notify health services. Faculty and staff would notify human resources, who will then in turn notify health services. And I'd like to turn the presentation over to Abby Wernicke.
Thank you, Jen. And now I'm going to talk a little bit about residence life, which for many of you, I'm sure you recognize has been, it's been a plan that's been evolving over the last several weeks. Where we are right now with the plan is that we have intentionally reduced our residence hall capacity by about 50%. This means that we have also reduced the capacity to allow for housing in single rooms only. And I must say that this was a decision that we took very seriously and was the result primarily of input and guidance that is coming from the city of Philadelphia as well as the Commonwealth of Pennsylvania. Residents, of course, will be required to comply with appropriate social distancing as well as other safety protocols. We've decided to hold move-in over the course of several days rather than just one day in order to allow for social distancing. Students may bring family members or guests with them on that day, a maximum of 2 guests, in order to help them move into campus housing. We do ask that students limit the number of items that they take with them and that they bring into campus housing. This will allow for easier cleaning. It will also allow for an easier move out should that be required at some point. We are requiring that international students and students who are coming from particular restricted states, according to the Pennsylvania Department of Health's current list, to complete 14 days of quarantine They can do that either off campus, or they can do that if they can do it, I'm sorry, off campus in advance of moving in, or if they are traveling here by plane. So rather than by car, they can quarantine once they're on campus here, and we will make arrangements for that with the individual students. Of course, we will, just like we're doing across the entire campus, we will post safety regulations and information about protocols throughout the residence halls, including in the hallways, in the common areas, and within individual rooms, suites, and apartments. We will be cleaning residence halls more frequently than usual, and that will include regular cleaning of common bathrooms, so daily cleaning of common bathrooms, or twice daily cleaning of common bathrooms, and once daily sanitizing of bathrooms. Common areas will have reduced capacity, or in some cases will be closed because they're too small to allow for social distancing. Residential programming will continue. We will absolutely be committed to providing an engaging student experience. It's just that a lot of that programming might take place virtually, or it will require strict social distancing. Masks, as has already been said, must be properly worn outside of residence bedrooms. It applies, of course, to all common areas within the residences and everywhere else on campus. In terms of our modified guest policy, students may not enter residence halls other than the ones in which to which they've been assigned. Beyond that, guests from outside the university will not be permitted inside the residence halls. I'm going to say just a brief statement about the status of athletics. I'm sure if we have any student athletes joining us here this evening, you're well aware that the conference that we participate in has announced that competition will be suspended for fall sports until January of 2021. We're currently developing plans for for restructuring of that competition that would take place in the spring semester. And we're also developing a plan for fall athletes to be able to participate in modified practices this fall, which will include things like individual skill building, small group practices that are contactless.
And so next I'd like to review with you the communication plan for the reopening of campus this fall. First, two of these have already occurred and one is occurring now. We've had these town halls for both faculty and staff. And now this one's tonight for parents and their and students. So on Monday the 27th, we'll be publishing our reopening plan on the Holy Family University website. This is the detailed plan that will go over everything that we talked about today in more detail. And so that will be up on the website July the 27th. Then the period of time from Thursday, July the 27th through, or August the 27th, excuse me, through Sunday, August the 30th. This will be the residential hall or residence hall move-in process. And then finally, the fall semester begins on Monday, August 31st, and campus opens, and hopefully we're all going to be safe. And now I'd like to review some discussion questions that we received from all of you in advance of your attendance of this town hall. First, there was a question about whether or not the tuition rates that are being charged for this new type of online and asynchronous and synchronous instruction are going to be reduced. And the answer to that is no. The tuition rates that are published by the university back in the spring are the tuition rates. The type of credit that you're gaining from the courses that you're taking will continue to count towards your Holy Family University degree. And we have truly made every attempt and are doing everything possible to create the same support mechanisms for you, as well as the type of classroom experience for you, as if you were sitting in a fully in-person, face-to-face classroom. So Now I'll turn it over to Mike Markowitz for some questions on academics.
Hello again. As you would expect, we got a number of questions from nursing students or family members of nursing students asking questions about safety when we resume our classes in the fall. Rather than go through each question, I thought I would summarize the main points because there was a significant amount of overlap between the questions. And I think in what I'm going to share with you, I should be able to address everyone's questions and concerns. First, the question was raised about the accelerated nursing programs. And in the past, they have, in some level, they've kind of danced to a different tune because they're located, at least half of them are located at the Newtown campus, and they have different semesters. In terms of uniformity, though, we have worked with the School of Nursing to ensure that all of the protocols, all of the procedures, all the protections and guidelines and requirements that apply to our full-time day nursing students will apply and serve to protect our accelerated second-degree nursing students as well. This includes requirements for protection of safety and clinical placements, as well as alternative assignments and alternative means of assessment should the ability to participate in external clinical assignments change. On that topic, we've also had several questions about the safety of our nursing students, if and when they go out into the field. One thing that we can say is the university will ensure that our students have all of the most sophisticated required protective equipment that they need. In particular, we were asked about advanced masks, the N95 masks. The university will be providing these to all nursing students who have an external clinical placement. Before nursing students will be allowed on the floors, before they will be allowed in the hospitals or in facilities, they will be required to fully gown up, if you will, in terms of their protective equipment. This involves gloves, gowns, boots, not only masks like these, but plastic shield guards that cover their faces. This is what is worn by nurses on the floors. This is what would be expected to be worn by our nursing students in those clinical placement settings. The university has not yet gotten the same number of clinical placement opportunities as we had before the pandemic struck. So the nursing department and our nursing programs have created state-approved options where students can work on virtual assignments or in our skills labs on learning the appropriate techniques that they need, not only to learn the skill set, but also to perform well on the ultimate exams that they take for licensure. If a student is in a setting and is exposed to COVID-19, that student, per the directives that we've already described, should notify the university. If a student is required to be out of class because of COVID-19, that student will not be penalized. It's important that the student stay in contact with his or her professors, their dean, and the health department here and health services here at the university. But if a student is required to quarantine for a prescribed period of time, the nursing programs, in fact, all of our programs, will ensure that that student does not skip a beat. They will be able to attend and participate in all of their classes virtually. There will be no penalty for that. Their virtual or electronic participation will be recorded as class attendance, and the system will recognize that. And faculty and administrators will work with all students to ensure that their plan of learning and their procedures of learning continue in the best way possible and as uninterrupted as possible. Of course, there will be failures. Of course, we will drop the ball. But the importance of this is that we stay in communication, effective communication, and if the university is not doing what it needs to do, let us know about it. Because our obligation, our firm commitment is to all of you, not only to ensure that you learn, but in these unprecedented times to ensure that you're safe and that the continuity of your instruction continues without a threat to you or your family members or your fellow students. Let me just see one, I just want to cover one other thing before I turn it back over to Eric. Oh, I actually, I'm sorry, I was looking at my list of questions. I talked about the attendance policy. Students will not be penalized if they have to be out of class because of exposure to someone who is possibly infected or because of infection themselves.
Very good. And actually, Abby, if you want to answer a couple of questions about
Sure.
student life.
Yeah, so there was a question about whether or not we are modifying our meal plans or our dining services, and whether or not the meal plans might change as a result of that modification to dining services. We're not altering our meal plans, and students will have access to the same meals and the same amount of food, if you will, that they normally would. The changes that students will see when they're in the commons and the dining services area are really related to safety precautions. So there will be traffic flow in and out of the service area will be monitored. Social distancing will be enforced. There will be reduced capacity in the seating area. And there will be enhanced to-go options for students who are more comfortable taking something that's been prepared ahead of time and grabbing it and going, and leaving the premises. And we've also added several outside tables to our patio area outside the campus commons so that students who feel more comfortable eating outside when the weather's nice can do so. I'll also say that we've eliminated all self-service stations in the dining, in the service area. So students, when they are being served their food, that will be handled by a professional member of the dining staff who is wearing gloves, mask, and other appropriate PPE. There was also a question about whether or not students would be required to take a COVID-19 test before they move into the residence halls. We are not requiring this. We feel that the most effective way to keep the community safe is to, as was mentioned earlier in the presentation, is to require the daily self-screening and self-monitoring of all of our campus community members. So some students have already received that questionnaire that is the list of daily questions they'll have to complete, but all students will receive that before the start of the fall semester.
One additional point with regard to questions about field experiences that I neglected to mention before. In addition to our nursing students, we also have education students and counseling psych students who have mandatory field experience requirements. For our student teachers, as long as schools allow us to go into the settings under their conditions, they will do so. Those experiences will be complemented or replaced with virtual assignments and virtual forms of interaction so that students will get the required state-approved hours they need in the framework of their student teaching experience. For our counseling psychology students at the master's and doctoral level, we had great success at the end of the spring with our telehealth options, where our students were able to log in, sign in virtually, and participate in session and even hold sessions themselves as they were accumulating their practicum and internship hours. If necessary, that will continue. If the pandemic has a resurgence, and we go on full quarantine again, those options will remain. Our commitment is to make sure that all of our students get the required hours, the required experience, and have all the tools that they need to successfully pass licensure. The one good thing that we have seen in this is a tremendous amount of cooperation from the state of Pennsylvania. The Commonwealth has really worked very, very closely with all of our professional programs to ensure flexibility and to make sure that we have as many options open to us as possible to ensure that our students can continue to progress toward the completion of their degrees in a timely manner and as effectively and efficiently as possible.
And now, this is Eric Nelson again, and now I'd like to address a few questions that were submitted. The first being submitted by a residential student regarding the liability, release of liability waiver that we're asking that students of adult age sign. I mean, simply, we're going to make every attempt to enforce our rules when you're on campus. But when you leave campus, we're going to have a hard time doing that. But we are requiring that before you return to campus, you fill out or you go through the self-screening questions in order to return to campus. But that said, because you did leave campus at some point in time, we have no control over that. So we're asking that you sign this waiver in order, quite frankly, to protect the university from what happens off campus. And we're going to, again, do everything we can to protect you while you're on campus. And so that's the reason why we're asking for you to sign that waiver of liability. There was also a question about no-touch water filling stations. You will notice when you return to campus that water fountains where you drink out of the water fountains are no longer in operation. But any existing water filling station, which were touchless, that you want to fill your water bottle or your cup up with, they all are in full operation. You can use those at any time. And finally, there was some questions about what's going to open. Are bathrooms going to be open? Is the library going to be open? Is the cafeteria going to be open? The answer to all of those is yes. All those facilities will be open. But you will notice that there's going to be strict limitations as to social distancing, the capacities of all those facilities. And as Abby gave more detail on the cafeteria, on how you're served and what happens when you're in the cafeteria itself. And so I think that, except for one question, I'll hand over to Jim Garvey again regarding one other question.
So, yeah, we had a question about whether or not the university will close its campus to everyone other than faculty, staff, and students. And the answer is we will be inviting visitors onto campus. We have actually developed a very detailed visitors policy. And the bottom line is that all our visitors we're going to have to, will be subjected to all the same rules and protocols as every member of this community, and that includes mask, social distancing, and self-screening before they come onto campus.
Okay, and so as I said, this is Sister Maureen again, and as I said at the very beginning, you know, it's all about education in its fullest sense in terms of instruction and in terms of your experience as students here, whether young, old, or middle-aged. We want you to have the best experience possible to reach your full potential. But as never before, it's going to depend upon cooperation, and it's going to depend upon goodwill. We're going to maybe have to remind each other, you know, if you watch television, everybody's reminding after every program, wear your mask, okay? So you may have to do that, and people may react to it. And we have to be tolerant, and we have to be, you know, our best possible selves if we're going to make this work. The other thing is that we can't not be flexible. As recently as last week, some of the rules of engagement were changed, you know, and so we had to again reduce class sizes and make adjustments to comply with the Philadelphia Department of Public Health. And so, you know, if we had had this last week, we would have said a little bit different about the classroom capacity. 50% is allowed. This week, 25% is allowed. You know, and when you're working with a limited number of classrooms, all of these changes have an impact. I can say honestly that, you know, the vice presidents and others around the table with me tonight have been working tirelessly since March 17th to gauge towards the reopening. The staff that aren't here have been working closely with us, and it's for no lack of goodwill. We don't want to endanger any of our constituents, faculty, staff, or students, but we want to maximize your experience because we think you can benefit from this type of education. So please be patient with us. We're trying to keep abreast of all these changes. We're trying to keep you informed as fast as we can, and you'll be hearing from us over the next few weeks with more specific details, and the plan will be published on our website with questions. If you feel that something wasn't answered, it's a burning question tonight, what I'm asking you to do is, it's on your screen now, direct your emails to president@holyfamily.edu. I'll be monitoring that account and making sure that it's directed to the right people and we get back to you as fast as we can. But please, goodwill, patience, and support for each other can help this work. It's going to be, and I hate the term already, it is going to be a new normal. But if we want to succeed, we're going to have to work together to have that happen. Thank you very much for being with us.
Thank you all.
Thank you all.
Everyone.
Thank you.